Thank you for joining us for our informational video on using the Millar Mikro-Cath for helping to diagnose obstructive sleep apnea. With over 50 years of innovating pressure sensor technology, Millar is the leader in pressure sensor solutions. We push the limits for advancing science by creating high-fidelity products for clinical and animal research and create OEM partnerships with global leaders in technology looking to integrate the best high-performance MEMS sensors. Millar's clinical catheter, the Mikro-Cath, is FDA and CE approved for human use in measuring pressures in the cardiovascular system, in compartments, and in airways. Today, we will discuss the use of Mikro-Cath in advancing our understanding and accuracy in diagnosing obstructive sleep apnea. Obstructive sleep apnea is characterized by recurrent episodes of the cessation of breathing. The interruption in airflow is due to pharyngeal collapse caused by anatomical predispositions and insufficient neuromuscular compensation. Initial side effects of OSA include sleepiness and daytime fatigue. However, research has shown chronic OSA to cause high blood pressure, stroke, and even decreased life expectancy. Because this syndrome is a combination of anatomical and neuromuscular elements, predicting successful treatment is difficult. Clinicians looking to treat OSA need the most accurate data. The Mikro-Cath is highly accurate, measuring within plus or minus 1.36 centimeters of water within pressures of negative 68 to 68 centimeters of water. Such precision enables them to make highly informed decisions around diagnosis. Millar's Mikro-Cath is a 3.5 French or 1.17 millimeter diameter solid-state pressure transducer with a sensor side-mounted at the distal tip. The catheter is 120 centimeters in length and made out of flexible nylon. The small diameter plus the flexibility of the catheter lessens discomfort when placing the catheter in the patient. With the Mikro-Cath, researchers and clinicians can gain insights into airway physiology by studying minute air pressure changes in the pharynx, larynx, and even pleural spaces for up to 24 hours in a patient. When comparing the Millar Mikro-Cath to traditional esophageal balloon pressure catheters, the 30% smaller diameter design allows for increased patient comfort and reduced risk of tissue damage when inserting and positioning the device. The Mikro-Cath also features the latest sensor-based technology mounted at the tip for highly accurate true pressure signals at the site of sensor placement. This differs from traditional esophageal pressure catheters where only a mean pressure is calculated along the length of the inflated balloon. As the Mikro-Cath does not require any form of inflation, setup, positioning, and signal recording can be achieved in 7 quick steps. Once the Mikro-Cath is placed, it can be left in situ for up to 24 hours with no requirement for readjustment, which is often not the case with balloon-type catheters. The Mikro-Cath excels at measuring small pressure changes. Because of its sensor design, the Mikro-Cath is used in a wide variety of applications. In addition to sleep apnea studies, the Mikro-Cath has shown promising results for collecting high-fidelity data during non-apneic events. Since the sensor measures pressure changes by deformation strain, the Mikro-Cath can be placed in pleural spaces to measure pressures during high-flow oxygen therapies. Finally, because it is a solid-state sensor unaffected by motion or resonance, the Mikro-Cath has been validated for studying laryngeal pressures during exercise and vocal cord contact pressures. Thank you for your time and attention as we covered the benefits and uses of the Mikro-Cath in obstructive sleep apnea. To reiterate the key points, the Millar Mikro-Cath is a highly sensitive, solid-state sensor-based catheter that excels at accurately measuring the low pressures which are seen in airway applications. Using the Millar Mikro-Cath in your studies adds the benefit of being able to measure pressures within the pleural, tracheal, and pharyngeal spaces with limited risk of damaging patient tissues or corrupted data from motion artifacts. For more information on how you can use Millar's Mikro-Cath pressure transducer in your practice, please visit www.millar.com. Thank you.